Okay, good afternoon, good morning. This is your Lab Exam 2 review, and I'm going to be pretty quick through this again, as I usually am. We've already detailed some things in the Lab Exam 1. Blood vessels, this lab includes, and if you look at your test schedule, it will tell you everything that's on each lab exam. So I hope you reviewed that. Some people still have not looked at that. I'm still getting questions that are already on there, folks. You gotta look at this site and go through and review everything because the information's there. But this will cover blood vessels, blood pressure, blood typing, lymphatic, and respiratory anatomy and physiology. Now that seems like a lot, but it isn't because these labs are smaller. You'll see that as we go through. What I try to do is divide the information into kind of equal blocks. So even though this is five or six labs, they're all small. Now the blood vessels, again, I have a list here for you. This list, as I do with my in-person classes, you guys are going to do the blood vessels on your own. You have a list, you have labeled diagrams. Most of the ones I'm asking you, not all of them, but most of them have to do with a regional term that we learned in Biology 137, such as radial, brachial, axillary. So these should be easy to look up. Let's show you the diagrams that are in the lab manual. You know, every once in a while you might see a left arm on there. This is a right arm that has radial artery. Well, if you see a left arm, the radial artery is still on the thumb side. So, you know, don't always memorize lines. Sometimes my diagrams don't match exactly. It's not really by intentional, it just happens. But you have these diagrams, I'm going to let you look those up yourself. All right, blood typing, very important. I am not using these plates on the lab. I will post, I have posted, I think, a separate file. When you go into the lab information, you will see the lab manual, and then you'll see blood typing. Those are the plates I will be covering. I'm also going to post a little review that I did a year or so ago over in my garage, in which I go through blood typing. So that will be posted as a review. So please review that prior to this test along with this review. So again, these, just X them out. I'm not using those. Look at the review and look at the other file here. Lymphatic. Whoops. There are 3 diagrams here. This is pretty self-explanatory. Number 1 and number 2, you can mark off this list. You don't have to know those. But number 3 through 10, some of these you can only see on certain diagrams. Here are 2 of the diagrams. Then you have one more diagram beneath that. They're all labeled. I'm not going to review this because what you need to know is right there. For example, I don't think you can see the nodes on any diagram as specific as this one. Cervical nodes, axillary nodes, inguinal nodes are the only ones I'm making you know. So I'm really cutting this down. There are many different nodes, you can see that. But these are the ones you will encounter most likely when you get out in a clinical setting, because some of these nodes you can't palpate, you can't feel them, they're very deep in the body. But you can feel the cervical nodes, you can feel the axillary nodes, you can feel the inguinal nodes when they are swollen, which doesn't necessarily mean that's a bad thing. It could be fighting disease as a function of lymphatic. So those are pretty self-explanatory. Respiratory anatomy, again, I have a list. 18 structures. I will go through this on this one. Frontal sinus, nostril. We're going to skip, some of these are digestive structures. The larynx is the voice box. The trachea, which I had you know for the digestive, you also know here, because it is a respiratory structure. Something that is not listed, you will see like a oval place right here in the larynx. If I will ask that, I'll point my own arrow to that. These are the vocal cords or vocal folds. I will probably put vocal cords. The top part of that oval is the false vocal folds. The bottom are the true vocal folds. But I will just point to them and collectively call them the vocal cords likely, which all of you are familiar with that term, I'm sure. The esophagus is a digestive structure, but I want you to know it on this diagram as well, because again, these are intimately located. Let's go ahead and know epiglottis again, because the epiglottis is protecting that respiratory portion. So the epiglottis, which you learned on the previous exam. The tonsils are a dual purpose structure. They can fight airborne disease or pathogens, and they can fight foodborne disease or pathogens. So I want you to know those again on this exam. Again, the one associated with the tongue is the lingual tonsil. At the base of the soft palate is the palatine tonsil. And then I'm going to skip up here. Again, it is kind of whitish or off-white, the pharyngeal tonsil. Let's go ahead and know the uvula again on this side, because it does protect your nasopharynx from food entering. Okay, very important. This is not real clear on this diagram, but it looks like you have two little teardrop or upside down teardrop structures here. At the very top of the bigger one is the opening of your eustachian or auditory tube. So this is where the middle ear drains into the throat. So the pharyngeal tonsil is strategically placed right above that. So anything coming from the ear, pathogen-wise, it's going to fight it. So the great engineer knew what he was doing here. The sphenoid sinus, you should know. And then the last one, I didn't explain this the first time I ever gave this test, which was probably, I don't know, 10 years ago of this particular diagram, but you have, if you remember from Biology 137, you have little scroll-shaped portions on bones in the nasal cavity. If you look back in there, you'll see them. But you can only see the middle and inferior nasal concha. The superior is hidden up too high to see. But we have a superior, middle, and inferior nasal concha. So on the test, I will likely put the A on these lines. If I do, the answer is superior nasal concha, or here, middle nasal concha, inferior nasal concha. You will have these typed out as choices. Previously, students had to fill in the blank, and some would just put superior and not put nasal concha with it. So, you know, superior, middle, inferior nasal concha. Okay, and let's go on here. I'm going to say blood pressure to the end. Okay, respiratory anatomy. We just saw the upper respiratory structures. These are the lower respiratory structures. There's just not a lot of anatomy here. And I think what I normally tell classes, Biology 137 is very steeped in anatomy. Biology 139 has a lot more physiology. This is why, I think I mentioned on the first review, that physiology probably come up and smack some of you in the mouth. Those, especially if more than half of you didn't watch the review. You know, the reviews are here for your benefit, and more than half the students didn't watch the review. So if you did, you were miles ahead on the exam. But the physiology is what makes this more difficult. So we have a list here. What I'm going to do here, number 5 and number 6, mark them off. Secondary and tertiary bronchus. I'm not going to make you know the whole bronchial tree. Some of this is a little difficult to see, but I do want you to know the larynx, the trachea, the right superior lobe, the right primary bronchus, which is kind of translucent through here. It's the first branch off the trachea. I want you to know the right inferior lobe, and then down here the right middle lobe, and then in the little inset, the terminal branch of the respiratory tree are the alveolus, or alveoli is plural. So these are the air sacs. Then coming down this way, left superior lobe, left inferior lobe. You only have 2 lobes on the left lung because of the heart. This area here is known as the cardiac impression. The heart takes up a lot of this space, so you only have a top and bottom lobe in the left lung. So pretty straightforward, very straightforward, not a lot of structures in the anatomy. So I've added a physiology lab to this, and I'm just going to explain this. We used to do this. Students a lot of times don't want to do anything in the lab. So a lot of times I'll do this as more of a demonstration, because you have to follow one particular person in your group or it doesn't work. And what we do is we come in and hold our breath. But what we're actually doing is we're showing the physiology in the lung, how you breathe based on the concentration of gases in your blood, either oxygen or carbon dioxide. Oxygen usually is good, carbon dioxide is usually bad. But if you get too much of either or too little of either, it can be a bad thing. So what we do 3 trials. The first trial, someone holds their breath after just normal breathing. And for example, let's just say the average person could hold their breath for 45 seconds. So then, exercise 2, we have them hyperventilate. Now I have in the lab 15 inspirations. Let's just say 20 inspirations. So you're hyperventilating. When you hyperventilate, you're putting more oxygen ultimately in your blood. So after hyperventilation, the student normally can hold their breath, say, for 1 minute and 15 seconds because you have more oxygen and it will allow you not to breathe. Then lastly, we have students walk up and down the steps, depending on what campus we're at, walk down the hall, come back and hold their breath. They might get 15 seconds. Because they're working and they're creating waste in the form of carbon dioxide, oxygen's going down, carbon dioxide's going up. Now, before I say more, I've made a little diagram, which is actually, I'm going to use this diagram almost exclusively on the lab to ask these questions. So we see over here, this is normal breathing, and it says O2 is equal to CO2. That's never true. O2 is always going to outweigh CO2 unless you're in major problems or you're going to die. But it is essentially, it is equal in terms of what we want it to be in the blood. It is normal. After hyperventilating, O2 is greater than CO2. After exercise, O2 is less than CO2. Now, I have 2 stars here. Disregard this one. Your primary respiratory center is in the medulla oblongata. That was covered in Biology 137. It had a cardiac center, respiratory center, vasomotor center. So we're talking about the effect on the medulla. If you're breathing normally, there is essentially no effect on the medulla as far as telling you to breathe more or breathe less. You're going to breathe at the normal rate, which is about 12 to 15 breaths a minute. If you hyperventilate, it's going to inhibit the medulla because your oxygen is already high enough in the blood, so it's going to tell you don't need to breathe right now. This is why you can hold your breath the longest here. And this little arrow says stimulates, because after you exercise, carbon dioxide's high, too high, oxygen is low, your medulla is going to be stimulated to make you breathe. So I'm going to back up here in a minute. This will help you out a little bit for the test possibly. In which situation were you able to hold the breath the longest? Number 1, this is hyperventilation. Why? Because your medulla is being inhibited not to breathe because oxygen is greater than CO2. Number 3, what does this tell us about the effect of each of the following on the medulla? Mark this out in the ponds. Just talk about the medulla. You have 2 situations here, basically. 2 of these things are going to happen simultaneously. Increased level of oxygen means we have a decreased level of carbon dioxide. So the top and bottom means it will inhibit the medulla. The middle 2, decreased oxygen, increased carbon dioxide, they go hand in hand. These 2 are going to be, it will stimulate the medulla. Why does normal breathing essentially not cause these centers to be stimulated? Because you have a normal ratio of oxygen to carbon dioxide in the blood. Number 5, can a person hold their breath until they die? This is something that I got to give you a little more information. No, they can't. Not without help. If you can do that, you will pass out. Then the breathing mechanism is both involuntary and voluntary. I can voluntarily breathe more. But what happens when I'm asleep? Do I have to wake up and tell myself to breathe? No. The medulla stimulates you to breathe while you're asleep. This is the main reason why you cannot die holding your breath. Okay, that really is all the information except for blood pressure. You will find there is nothing about blood pressure in the lab manual. The reason for that is we do this as an in-person lab. We get out the blood pressure cuffs, the stethoscope, the sphygmomanometer, and the stethoscope, and we try to teach people how to do it. A lot of you already know how to do it. What I will ask on the test, I think I mentioned it in the review for the first lecture exam, there is a diagram in the chapter 15 of the pulse points. And if you didn't watch the review, or if you don't watch the reviews, you're out of luck. If you did, you already know this. But it lists different points, such as the radial, the brachial. And I told you to specifically pay attention to the radial and brachial. The radial is the most common place to take a pulse. The brachial is where we are listening for blood pressure. I'm not going to ask procedural questions about blood pressure taking. You will learn that. Those of you who are going into nursing will learn it in the technical part of the program. In your clinicals is what I'm looking to